amazing under an hour neck lift.
I'm so happy. I can't believe it.
Today on The Doctors, we're changing every body, one body at a time. Coming up.
I've always had this little second chin going on, and I hate it.
We have just a bunch of flabby skin now at this point. We've loosened it up, and we're going to kickstart it with a laser.
You're not feeling a thing, right?
Nothing.
And our next guest is only 34, but says she has a frustrating problem that's making her look and feel much, much older. Take a look.
Ever since I can remember, I've always had this little second chin going on. I've given it some names like turkey gobbler, chicken neck. Oh, gross. It got much worse during my early 20s. It's really upsetting because no matter how much I diet or exercise, it just never goes away. It makes me look 10 years older, and I hate it. I'm a freelance makeup artist, and I do classic pinup modeling. The neck waddle has always been a problem because the photographer has to Photoshop it out. I definitely think I'm too young to have this problem.
Dr. Orden is back in our procedure room with Jordana and cosmetic surgeon Dr. Thomas Barnes. Welcome.
Thank you, Dr. Travis. I am here with my colleague, Dr. Tom Barnes, class of 79 USC. We were classmates. Small world.
Yeah.
But he's got Jordana, his patient, and he's showing us what he likes to call his lunchtime neck lift.
That's right. What we're going to do today is loosen up the skin so that it can shrink. Then we're going to go in with our special laser that helps stimulate the cells that regenerate youthfulness and cause shrinkage. And this is going to happen immediately. It's like magic.
I want to see this. Okay, so we're going to get started.
You feeling good?
So what he's doing is a little pre-tunneling with his cannula here to create what we call, as I said, tunnels, and he's going to remove a little bit of fat.
You can see we have just a bunch of flabby skin now at this point. We've loosened it up, and that skin wants to tighten, and we're going to kickstart it with using some heat with a laser.
Okay. Yeah,
And Jordana,
obviously she was locally anesthetized. She's fully awake. She's not in any discomfort.
Well, Jordana, I can tell you our audience, I think, was struggling more than you. We're going to check back in with all of you in a bit, but right now,
it's time for phase 2 of this process.
Now we can get another level of shrinkage by using this great little laser. And as I put it to my hand, wow, it's starting to get hot.
We're shrink wrapping, right?
Exactly.
well, we did meet Jordana earlier, who at the age of 34 feels she's way too young to have a saggy neck. So we're going to check back in with Dr. Orden. Right now, back in our procedure room with Dr. Thomas Barnes, they're performing a lunchtime neck lift. How's it going, guys?
Thank you, Dr. Travis. It's going very well. And as you can see, we now have the shades on because it's time for phase 2 of this process. Dr. Barnes did his pre-tunneling with his cannula, removed a little bit of fat, but now it's time for skin tightening. How's that being done? It's being done via laser, generating heat that's going to contract the skin and help form new collagen.
Exactly. Now we can get another level of shrinkage by using this great little laser. And as I put it to my hand, wow, it's starting to get hot. And that's exactly what it's going to do.
We're shrink wrapping, right?
Exactly. We're shrink wrapping.
And what I'm doing with this little device I'm holding, I'm monitoring how much heat is being put in to the dermis here below the skin. It's all about heat therapy to shrink the skin and cause collagen production, but at the same time, we don't want it to get too hot, so I can monitor the temperature on the temperature gun here.
Exactly right. And we can do this procedure, by the way, just about anywhere on the body for a lunchtime procedure.
So why don't you guys finish up back there and we'll check in and see Jordana's final result in just a little bit.
Thank you.
Coming up, but first, the results of our lunchtime neck lift are next. Don't go away. Well, if you're like Dr. Orden, you just keep getting better with age.
Well, thank you.
But for the rest of us, sometimes a little help is in order, and that was the case for 34-year-old Jordana, who said that her saggy neck was starting to get in the way of her career as a pinup model, but no longer.
That's right, and we're here with her surgeon, my colleague, Dr. Thomas Barnes. We've been in back through the course of the show in our own procedure room, and you had what Dr. Barnes calls his lunchtime neck lift.
Exactly. And how do you feel?
I feel fine. I feel great.
Now, she hasn't seen it yet.
That's right. Let's remind ourselves. Let's take a look at Jordana's picture before you did your treatment.
Okay.
So that's her. A little bit of excess skin, a little excess fat.
Well,
And Jordana, you haven't seen yourself yet, have you?
No.
Can you see yourself in the monitor?
Yes. Oh my God.
Well,
That's amazing.
being a model, you're used to looking at your face. What do you think?
Looks amazing. I'm so happy with it. I can't believe it. I can't believe it's done.
And the interesting thing is the best is yet to come.
that's right. It's going to get better and better, as Drew knows as a surgeon. Every day it's going to shrink more over the next couple months, but she's good to go if she wants to work or do a photo shoot tomorrow. She's good to go.
Well, Jordana, you look great.
Thank you.
Thank you for being here. Dr. Barnes, thank you.
Thank you very much, Drew. Good to see you, Ken.